I think this is an important election on many levels, particularly in the United States Congress. I am a common sense conservative who has worked hard in the agenda that I ran for Congress specifically in, and that's healthcare. Pennsylvania is an incredible state that has the most number of medical schools of any state in the union. And yet we face doctor shortages in Pennsylvania. The analogy we make, that's like going to Texas and saying there's an oil shortage. Why should there be a shortage of doctors in Pennsylvania? Realizing that, we started on the first meeting in Washington discussing how to bring more doctors to South Central Pennsylvania. The idea of the Homegrown Healthcare Initiative was born, where we interfaced with medical schools and hospitals to allow students to spend the entirety of their third and fourth year in South Central Pennsylvania and allow many of the students to return home to work in the hospitals where their families work, sometimes in hospitals where they have been born, and allow them to develop the mentorships that will allow them to encourage to return home after medical school. It's something that we're very proud of. It's what I ran to serve in Congress to increase the ability of physicians to serve in South Central Pennsylvania.
There's really two fundamental reasons why I'm running for Congress. First and foremost is that I care about my fellow citizen. I care about the well-being of the families of PA-13. What this COVID-19 pandemic has thrown at us has really turned all of our lives upside down. But beyond what we're all facing in regard to this COVID-19 pandemic, it is about ensuring that our economy works for everyone, that it doesn't just work for big corporations and Wall Street, but it works for the working class, those union men and women, those families that across PA-13 that are farmers, our teachers, our coal miners, our truck drivers, our steel workers, our nurses, our first responders, all those essential workers that have been at the front lines in keeping our country going the last 9 months. That's who I'm fighting for.
The ACA hasn't lived up to its first initial, and that's A. It is no longer affordable. It was a mandate that was not successful. What we need is affordable health care that allows individual patients to first and foremost keep their doctors and to cover pre-existing conditions and to also have the ability to have affordable prescriptions. Right now, there is a plan that we've studied in Washington through the Republican Study Commission that will allow individuals through many different vehicles to have the insurance that they choose, the health care they choose, that makes medicines affordable and also allows individuals to keep the physician of their choice.
The foundation of the Affordable Care Act, it provides a vehicle for our country, for Americans, in order for us at some point to reach what I believe and what I support as a universal health care coverage system in this country.
You support universal health. You support universal health care.
I do. I do believe that, Matt. I believe that health care is a basic human right. We are all humans. We are all susceptible to experiencing an injury or being diagnosed with a catastrophic disease that without the proper insurance coverage and having access to affordable quality healthcare coverage that could place an individual or a family in a financial situation of bankruptcy. And no family should ever experience that by needing the healthcare that we as humans need.
I think what was so important with the CARES Act is that we provided relief to small businesses, and small businesses make up such a large portion of South Central Pennsylvania. It's often said that small businesses are the backbone of the area. I actually think they're the heart and soul of the area. And through the Paycheck Protection Program, a forgivable loan was brought forth from the CARES Act, which allowed these small businesses to continue to pay their employees as their businesses stalled to get through that to that next step. And there are additional funds that are remaining in the PPP. And I am advocating in Washington that those funds be released, that small businesses once again have access to help them through this dark time. We are going to come through. We're going to come through brighter and stronger, and we can do this through the Paycheck Protection Program.
And I'm hopeful that that type of stimulus relief to the citizens of PA 13 in the country, I'm hopeful that that will be addressed prior to that period, after the first of the year. But Matt, I'm a big supporter and proponent. If you look at what the HEROES Act will cover, it will get us through this period. And until we have the leadership that can provide us that plan that will manage this COVID-19 situation, where that plan manages to lower and to halt that infection and fatality rate, that's what we have to do. And until we do that, the American people are going to continue to suffer, and our economy is going to continue to.
I think that the pathway through this pandemic is through therapeutics, medicines to treat the coronavirus, and through a vaccine. And Operation Warp Speed addresses both of those. Importantly, a public-private partnerships with pharmaceutical industries in Pennsylvania and with the Department of Defense to develop therapeutics, and not just the ability to have just a vaccine, but to have therapeutics to treat someone in the acute stages of the coronavirus. But in addition, the development of a vaccine to provide the long-term immunity that will allow us to come through stronger and brighter. We need to be able to do this. A vaccine is part of the pathway out. Therapeutics is the other part of that pathway.
First and foremost, when you're out in public, wear a mask. Wear that mask when you're out in public. Secondly, be cognizant of that social distancing that we're all, I believe, trying to achieve. And also the third thing, just very fundamentally, washing hands frequently. Those three things can carry us forward on that path towards lowering that infection and fatality rate. Those three things, if we all, as citizens, as Americans, if we all buy into that for a period of time, we can find ourselves moving towards that place where we need to get back to from an economic standpoint.
Racism in any form is unacceptable. There's no question in my mind about that. And yet our country requires law and order. We need law and order to be a successful country. We need to protect the rights of the individual citizens. We can do both. We can do this. We've sponsored legislation in Washington, the Justice Act, that would provide the ability for the police to have additional training and yet protect the citizens as well. There is an important issue at hand. We have to be able to address that.
We have to take head on why it is that we have the social and injustice that we have within our society. And a lot of that speaks directly to the economic inequality that we have in this country, where it starts with poverty and homelessness and substance abuse and the lack of job opportunities and education. That is one area of where we as a society, we have to invest in. We have to invest in that. And from a police reform aspect, we have to recognize that from the hiring of our men and women that we are entrusting to serve in this most important position within our society, within the training based in de-escalation.
I am. I think that we have to understand that we have to be able to vote in person. We have to be able to do that safely. I encourage everyone who's watching this, get out and vote, make your voice heard.
The big message here from me is that please vote. Whoever you vote for, please participate in that most fundamental civic duty that we all have as Americans. Please vote. And there's still time to register to vote. And if you haven't yet done that, that's that first step in you taking that most fundamental, important step in what it means to be an American, to participate in our electoral process.